selection committee that was hard choices, and I'm just honored to be here. And I'd like to thank the vascular unit for having me there. The title of my exemplar is In Her Shoes, Jill. There are two words similar in construction but very different in meaning, introduced and expounded upon during one particular class of my nurse training. Empathy understands the feelings of another, while sympathy is sorrow for another's pain. I remember as I sat in that class that day thinking that there wasn't really that much of a difference in those two words. Today, a little older, more experienced in my nursing practice, I realized that nothing could be further from the truth. In my position as a bedside vascular critical care nurse, I've come to anticipate arriving for my scheduled shift to receive a particular type of patient. The individuals that I routinely care for generally have a wide array of cardiovascular issues that have negatively impacted their quality of life by inhibiting blood flow, whether systemically or peripherally. However, we also receive patients suffering from a broad range of comorbidities from other critical units due to lack of bed availability. Recently, one such patient again reminded me of the difference between empathy and sympathy. For the sake of confidentiality, we will call her Jill. She was pale and frail, a wisp of the strong woman her patient history, tattoos, phrases, and mannerisms indicated her to be. A bandana covered her head, bare from many rounds of chemotherapy and radiation given to treat the cervical cancer that had laid siege to her body, initially with silence, and then with screaming vengeance. Development of rectovaginal fistula and subsequent treatment measures had taken their toll, and pain was Jill's ever-present shadow. The palliative care team had completed their consultation and initiated arrangements for hospice. The plan of care and primary goal of the evening was to control Jill's pain. Based upon her transfer to floor status, vital signs per unit protocol were completed every 4 hours. However, Jill's pain control presented a constant need. I administered oxycodone orally every 4 hours based upon Jill's verbalized pain score rated on a scale of 0 to 10. In addition, 2 to 4 milligrams of morphine was given intravenously every 2 hours for breakthrough pain. Administering ice chips and providing frequent oral care using sponge swabs with mouthwash helped to control her dry mouth and nausea. Hourly skin monitoring and providing perineal care were beneficial in decreasing risk of further infection as well as patient comfort. During the course of the evening, as I carried replacement supplies and linens into Jill's room between bouts of pain medication and perianal skin cleansing, I recognized a higher level of stress in her than I had seen earlier. She was in a state of sorrow, experiencing a warring, weeping pain that medication and skincare could not address. I believe knowledge is power, and in knowing what she was thinking, I thought I might find the power to help alleviate her mental and emotional pain. So I asked, what can I do to help you? In the moments that followed, Jill shared her sudden recognition that she would not be returning to the job she had since high school as a machinist in a factory, working alongside her father. She said no one knew how she felt, having never had cancer. How could they truly understand what she was going through? It made her feel so alone, and more than anything, she feared being alone. As nurses, we're taught to maintain professionalism and to keep a separation between ourselves and our patients. However, in this instance, in light of my patient's needs, I could not let the moment pass when I had something I could offer her. Diagnosed with breast cancer 6 years prior, I knew how she felt. I had been in her shoes. In the moments that followed, I shared my story. Did my conversation take away her pain and give her hope that she would get better? No. But it eased her spirit, and she expressed her thanks that I understood her better than others did. The Code of Ethics for Nurses, as set forth by the American Nurses Association, provides for the premise that the nurse's primary commitment is to the patient. Delivering compassionate, effective, and ethical patient care means we do feel sorry for another's pain, and we do attempt to understand another's feelings, but frequently fall far shorter because we've not experienced their challenges. Empathy and sympathy are indeed very different emotions, and each has its place in providing patient care. There are two of the benchmarks of excellence in nursing. As I continue in my nursing practice, I long to exemplify the superior quality of our time-honored profession, and in doing so, bring true healing to those who need it.